Disease X. It sounds scary, and it was a major source of controversy at the World Economic Forum's globalist gathering last week, where panelists discussed this hypothetical illness. But what exactly is Disease X, and how do you prepare for it if it doesn't exist? Let's dig in. Tamara Ugolini here with Rebel News to bring you focused coverage of Disease X, a hypothetical disease scenario that the World Health Organization, the WHO, and its private sector partners have declared a priority disease. The WHO has developed research and development blueprint for the private sector, whose aim is to fast-track the availability of effective tests, vaccines, and medicines. And WHO Director General Tedros Adhanom Ghebreyesus is the unelected global authority on all of it, and he is who is responsible, if there were any form of accountability, for the devastating public health policy instituted worldwide throughout the disastrous COVID-19 response, from harmful lockdowns to discriminatory and autonomy-infringing mask and then vaccine mandates. Yet he was lost for words when our Australian chief reporter, Avi Yamini, questioned him about Disease X during our boots-on-the-ground journalistic coverage in Davos that you can find and support at wefreports.com.
Dr. Tedros, how you doing? Do you think you did well in COVID, and if you're going to do as well in Disease X? Mr. Tedros, how you doing? How do you feel you went in COVID?
We're rushing to a meeting.
Oh, we can
maybe later on.
We'd love to walk with you to the meeting. What's the meeting about? Is it about Disease X? Do you apologise for what you did during COVID? And should people have to go through Disease X with you now that you say it's 10 times worse?
Sir, it's a simple question. Do you condemn public health interventions like lockdowns and vaccine mandates?
The slogan for the WEF agenda.
Are you going to apologise for getting everything wrong, from mask mandates to vaccine mandates?
Okay, sorry.
Don't push me. Dr. Tedros, this is your chance to apologise to the world for your role during COVID. Would you like to take it?
It's okay to get...
Do we have to wait for you to get everything wrong in Disease X? Do you think the vaccine mandates are wrong? You got everything from mask mandates to vaccines wrong. Do you want to apologise? Or do we have to suffer? In Australia, we had the longest lockdowns in our city, and that was based on your advice. You don't want to apologise to Australians or anyone? What about the current excess deaths? Do you want to talk about those? Do you take any responsibility for people who died because of the policies you pushed? It's regaining. They say regaining trust is the theme this year. Are you part of the reason why they've lost trust in the WEF and everybody finally knows who you are and what you stand for? Thank you, Dr. Tedros, for showing us how transparent you and the World Economic Forum really is. wefreports.com.
Now, he was lost for words then, but not during the Disease X panel that same day, where he described this blueprint placeholder for when, not if, a hypothetical disease comes. Look at this.
Especially the Disease X, it's attracting a lot of attention. And I hope you have seen in the social media. But it's not a new idea. The first time we used the terminology was in 2018. The discussions were in 2017. I was just new Director General. As you know, we annually list the emerging diseases. And MERS could be one, Zika, Ebola, those we know. But then we said, there are things that are unknown that may happen. And anything happening is a matter of when, not if. So we need to have a placeholder for that, for the disease we don't know that may come. And that was when we gave the name Disease X. So Disease X is a placeholder for unknown disease. I just wanted to start by clarifying that because there is already a lot of attention. If I may, although COVID came immediately, we were preparing for COVID-like disease. You may even call COVID as the first disease X. And it may happen again. Of course, there are some people who say, oh, this may create panic. No. It's better actually to anticipate something that may happen because it has happened in our history many times and prepare for it. Yeah. We shouldn't face things unprepared. We can prepare for some unknown things as well because there are basic things you can do.
Tedros says that COVID was the first disease X and that the private sector, otherwise I think known as Big Pharma, will be at the center of the blueprint to test drugs and other tools, but refrains from mentioning vaccines specifically, even though, remember, the blueprint's entire aim was to fast-track the availability of effective tests, vaccines, and medicines. Of course, Tedros says that global compliance with the WHO's controversial pandemic agreement is pivotal to better understand disease X. Listen to this.
The other key in order to have better prepared and to address the disease X is the pandemic agreement. The pandemic agreement can bring all the experience, all the challenges that we have faced and all the solutions into one. And that agreement can help us to prepare for the future in a better way, because this is about a common enemy. And without a shared response, starting from the preparedness, we will face the same problem as COVID. And deadline for the pandemic agreement is May 2024, and member states are negotiating. This is between countries. And I hope they will deliver this pandemic agreement by that time, on the deadline. Because if this generation cannot do it, we're the lived community, we have the first-hand experience, I don't think incoming generation, the next generation will do it. So for our children and grandchildren's sake, I think we have to convert all the lessons we have learned into this pandemic and prepare the world for the future, because this is a common global interest. And national interest, very narrow national interest, should not come into the way. Of course, national interest is natural, but it's the narrow national interest that could be difficult and affecting the negotiations even as we speak.
This unelected, unaccountable oligarch has the audacity to tell and urge participants not to let national interests obstruct the cooperation with this agreement that is being rammed through without due process in what independent researcher James Roguski has referred to as voting fraud and in contravention to the WHO's own guiding principles.
They are actively conspiring to break the rules, break Article 55. They've scheduled meetings for February and April, and they have said, forget about, the 4-month rule. They're just going to keep negotiating right up to the last minute and submit a document that nobody's really had a chance to see. The other reason why I expect them to cheat is they lied and committed voting fraud in 2022. On May 28th, 2022, they published a document that said that they had adopted amendments to 5 articles of the International Health Regulations. Well, the only problem is when you watch the meeting that they claim that happened at, they never even mentioned it. So they claimed that these amendments were adopted by a vote of the Assembly, and they never had the vote.
And if you watched my report last week on how Canada is helping to fund a global vaccine empire through things like the Access to COVID-19 Tools, also known as the ACT Accelerator Program, you will know that the federal government has contributed $2.1 billion to this WHO-centric initiative. Another source of funding of this vaccine empire is the $100 million contribution by the Government of Canada to the Coalition for Epidemic Preparedness Innovations, otherwise known as CEPI, to accelerate the development of vaccines against emerging infectious diseases. CEPI plays a pivotal role in Disease X. Look at their response to the public criticism over this hypothetical simulation pathogen in this news release titled What Disease X Is and What It Is Not. In there, they used a search insight tool known as Answer the Public to hone in on the most popular search terms from 4 countries over the last 12 months. They say that safe and effective vaccines have significantly reduced COVID-19's mortality and morbidity, saving an estimated 20 million lives in the first year of their rollout, which is hyperlinked to an imaginary modeling study whose parameters used controversial, official, reported COVID-19 death data and was funded entirely by vaccine propagating organizations that profit from their use, like Gavi and the Bill and Melinda Gates Foundation. They assure the reader that this is certain, that a future Disease X is out there. A major component of this blueprint and its subsequent framework is, as mentioned, so that scientists can get a head start by creating new medical defenses such as vaccines and treatments that can be swiftly adapted to target a new viral disease. And they'll do this by implementing CEPI's 100 Days mission. It's a plan to make new vaccines against known or novel infectious diseases within 3 months of their pandemic threat being recognized. It's textbook problem reaction solution. And so naturally, CEPI has already partnered with private thin film company Gerada to develop needle-free vaccine patches. And they've also partnered with the Korean University to develop novel self-amplifying mRNA vaccines in, there it is again, as little as 100 days. CEPI says that the self-amplifying design works by giving the body instructions to replicate mRNA, modified RNA, which could amplify the amount of protein made and reduce the amount of antigen, necessitating fewer vaccine doses and reducing the cost of the vaccine. All of this sounds like it could be a lot like gain-of-function research, a branch of medical research that genetically alters an organism with the aim of enhancing its biological functions to increase things like transmissibility, virulence, and immunogenicity. In a summary workshop on the potential risks and benefits of gain-of-function research in 2014, Dr. Jerry Weir from the Food and Drug Administration's Center for Biologics, Evaluation, and Research said that gain-of-function, or GOF, studies have had an enormous influence on how we develop vaccines over the years and can help improve the process with the challenges that we still face. Yep, COVID certainly was the original Disease X, and the novel mRNA injections served as a prodrug, as explained by geneticist and genomics expert Kevin McKernan.
Never before in history have we had a prodrug like this. This is effectively what it is. This is an mRNA. It's not the drug itself. It's going to go into your cells and create the drug. They are only theorizing what it's going to create. They have not demonstrated publicly what the mRNA is from a sequencing standpoint, where we see the raw reads and we can actually see the error rate in the vaccine production, because there is an error rate making these vaccines. These mRNAs are not faithfully reproduced when they synthesize this RNA. There's error rate there. When you have those modified nucleotides, when the ribosomes read them to make proteins, there's error rate there. It's known, it's measurable with this particular base. This has not been characterized. So we have a prodrug that's producing a drug, and the drug is not known. It's being given to billions of people with zero liability. This has never happened before in medicine.
This intricate web of private-public partnerships raises concerns around the true nature and consequences of orchestrating a global response to emerging infectious diseases, because it seems like Disease X is a fear-mongering tool used by unelected global health self-appointed authorities in collaboration with the private sector to fast-track novel vaccines and biological products into the global population. For Rebel News, I'm Tamara Ugolini. To view all of our World Economic Forum related content, from written pieces on various panel discussions to boots on the ground journalistic efforts, you can find all of it at wefreports.com. And if you appreciate that we can bring you this kind of extensive coverage unlike anyone else, please consider supporting our work through that same website, wefreports.com. Thanks for your support.